Hi everybody, this is Jenny Guthrie. I'm the owner of Glow Medical Aesthetics in Tulsa, Oklahoma, and we're going to talk a bit today about under eye filler. Of course, there was a video that was played a lot. In fact, I was so sick of seeing it, I got off social media for a day, about a botched under eye filler that happened to a celebrity. But what we're going to do is talk about how to avoid this. So under eyes can be tricky. They're not very forgiving. There's about 3 tissue layers here where we have about 5 tissue layers in the mid face. So it's just not forgiving. So we have to be really careful. And here at Glow, I like my injectors to have a little bit more experience. I want them to inject for about a year before we actually train into your troughs. Because as I tell people all the time, most of what we do with injections is very tactile. There's a feel to it. And you just have to get experience under your belt to know what you're feeling. So the way that I prefer to do under eyes with a hyaluronic acid filler, my favorite is Volbella. It's FDA indicated for this area. I'm an Allergan fan, so I'm gonna use Volbella. I'm gonna be down deep, basically on the bone, under the muscle, because then I have more grace with how I'm going to lay my filler in that regard. Because anytime you lay it superficially, because of the anatomy of the area, the muscle connects to the skin and the filler can get into the muscle, and then it can get lumpy and bumpy as we blink and we laugh and we make facial expressions. The other thing is this area is very rich with lymphatics, especially the malar fat pad. And anytime we get an HA filler in there, it kind of gummies up the works with the lymphatics, and then it can make under eye puffiness and bags, and it looks awful. It's just not good at all. So my preference is not to do the filler superficially, it's to do it down deep using a cannula. It's very rare that I'll use a needle in this area anymore because I have such good results using the cannula. And if you do use a needle down on the periosteum, you just want to be mindful. There's a foramen over here that I have had positive aspirates with, so you just want to be mindful of that if you are going to use a needle.